Hello, everybody, and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin. And as always, I'm excited that you're here. And I've welcomed some amazing guests on this podcast before, but we have a very special guest today, Dr. Mark Doherty, who is a dynamic dental specialist and a sixth-generation dentist, owner of several dental practice entities. Dr. Doherty currently serves as CEO and co-founder of D4 Practice Solutions, CEO and owner of Commonwealth Mobile Oral Health Services, and co-owner of South Coast Endodontics. Mark, thank you so much for being on the podcast.
Bryan, thank you so much for having me. I've been so excited to be here today. I feel like almost like a kid on Christmas morning. I know we've had some great discussions in the past, so looking forward to this.
Well, you have, just a wealth. You're one of the relatively rare dentists who kind of are multiple different roles, doing multiple different things in the industry. And so, you where do you see opportunities for our industry to really grow and elevate? Because I think you progress many different aspects of care. So where do you see as an industry we can have the most growth? That's a
So
loaded question.
that is
I
a
know.
loaded question, and it's a great question. And my mind is going like a million different areas. You know, I think certainly with the challenges that we're facing these days, with workforce shortages, with getting people on board, I think AI and technology is going to be a big part of the future of dentistry. But as you're well aware, even though there's so much out there in terms of technology, in terms of AI platforms, it can be overwhelming, right? It can be overwhelming for us as the dentists or as the business owners to align ourselves with the proper platform that can fit our needs. But still, I feel like if we can get to a point in the future where things are integrated better, meaning the platforms, it's going to help us and alleviate some of the stresses that we face with having these workforce shortages. And we know burnout is at an all-time high here for dentists. I just think I read the other day that it's about 80%, which is crazy. So I think anything that we can do on the tech side is going to benefit us clinically and administratively.
Well, it sounds like I teed you up to to talk about what I'm working on. So thank you for that. A little tear
No,
escaped my eye, but yeah, I thank you. Obviously agree with you, and I think that there's massive opportunities there. And we were talking a little bit about your work with FQHCs and how that mirrors DSOs too. And so I just for the audience, because a lot of people, I would guess that a lot of people who are listening to this podcast aren't even familiar with FQHCs, what they are. So could we start there
absolutely.
and
So
how you
that's
got involved?
fantastic. So FQHCs are federally qualified health centers. Basically, these are dental practices of health centers nationally. I think there's around 5,000 FQHCs in the nation. And basically, they're serving Medicaid patients who are pretty much underinsured and underserved. So, once again, a lot of Medicaid. And for our dental consulting business, D4, we have done years and years of consulting for these FQHCs on a national level. And, for me, I kind of walk the world of public health dentistry and I walk the world of private dentistry. And what I've come to notice, and with having my own practices and businesses and growing and expanding, is that I'm starting to see a lot of similarities actually between the FQHC world and the DSO world. And the similarities that I'm seeing are, first off, the structure, the infrastructure. In both the DSO world and the FQHC world, we have an administrative level. We have a C-suite, right? We have the administration, the business owners. We have CEOs, CFOs, HR. Then we also have the dental providers, and we also have the frontline dental workers. What I'm also starting to see within DSOs is a lot more talk about quality of care, value of care, measurement and metrics. And honestly, I from what I've seen over the years in my experiences, I think that DSOs can actually learn a lot from the FQHC world. And I say that because FQHCs forever, I mean, they're very scrutinized, right? They have audits by HRSA all the time. They have audits by the Department of Public Health. So they have to be very well in compliance with the services that they're providing to their patients. In addition to that, we talk about quality of care. We talk about measuring the quality of care, the outcomes that we're providing to the patients. In the FQHC world, they have a lot of metrics, measurements that they go by, that they track to show that they're making their patients healthier. And, in a world where in the FQHC world where it's more challenging for access to care because there are just so many individuals that need that care, it's not always easy to measure the outcomes of the patients. And certainly, whether it's public health dentistry or private dentistry, we all have our barriers to success. But I think the FQHC world has a long history of doing this. They also have a history of integration with medical and dental because in most of these health centers, you have a medical center and a dental practice. So they're co-located. So when you talk about integration and you talk about sharing of systems of electronic medical records, electronic dental records, that capacity is there. But there's still challenges with it. There's still barriers and it's still underutilized. But we do see in the FQHC world integration of medical and dental, whether it's training of medical professionals on how to do screenings, on how to do education for their patients, on how to do fluoride. It's about having champions within those FQHCs and navigators helping the patients get maybe curbside consults with dentists from the medical side or warm handoffs. There's just a lot to be explored there and a lot to be learned there. And, it's not like every FQHC has this down packed. And in fact, a lot of them need help with that. But I think the DSO space could learn much from the FQHC world. And I see where I'd like to see more collaboration in those two spaces in the future. Sorry, that was pretty long winded.
No, it's great and a wealth of information. And now my mind's going a million miles an hour because we could probably be here for 15 hours unpacking a lot of the great stuff that you said. But two big points that came out with that I'd like to sort of discuss. So number one, I've been going to more DSO meetings now because when we're solving interoperability and if you have multiple systems, multiple practices, obviously the sort of problems and opportunities of interoperability scale exponentially. So I've been going to the DSO world conferences, and what shocks me is how it's almost like a totally separate industry from when you go to like the Chicago Midwinter or the Greater New York. It's very different, even though we're in the same business, training the same patients. It's a completely different perspective, and it sounds like and then if you go to like a medical conference, of which I've been to many of those, it's a whole that's like not even in the same galaxy. It's a totally different universe. And it sounds like there's a whole subset of FQACs that is like another industry, sort of sub industry in and of itself. Is that true?
So work more on that. I'm kind of confused on that part.
Well, yeah. So if I go to a DSO meeting, for example, right?
Okay.
Oftentimes, like
Okay.
you and I may be the only dentists in the room, right? And they're talking about maybe same store growth and aggregations and EBITDA. And if I go to traditional, the way I look at it, dental meeting, they're talking about bonding agents and the new, composite 14.0 that they just came out with, or
Yeah.
so
Yes.
like the
Okay.
actual delivery of dentistry. And because I haven't yet been to, sort of explored this universe, which I'm very interested in and doing now, but it feels like there's, for example, just like let's talk about compliance, right? If you go to talk about compliance at the Chicago Midwinter, there'll be two people in the room and they're basically pissed off, right? And so if you go to the DSO world compliance, it's probably about, in my opinion, it's probably like I'm scared, so we might have to make sure that we have these box checks. And I would guess this is you can confirm or shoot this theory down that in the FQHC world that it's about opportunity of how we become compliant so that we can get reimbursed more.
So yeah, so thank you. So, so first off, I would say in the FQHC world, the major meeting is an annual meeting. It's through NOAA, National Network for Oral Health Access. This year it's in Denver. And, you'll see about 1,000 people there at this conference, which is great. And so, a lot of the presentations are going to focus on prevention, quality of care, compliance, yes. It's going to talk about access to care, how we improve access to care. Another concern that we see big time is scheduling and no-shows and broken appointments. And in fact, I'm not sure if you're too familiar with the Health Policy Institute of the ADA, led by Marco, but I love their resources. They just came out with great information showing, once again, another similarity here with DSOs, with public health settings, i.e., FQHCs, general practices. The biggest concern right now for dentists in not filling the schedule is broken appointments. So patient failures within 24 hours. So again, just another similarity there. And so, broken appointments, that's another big thing that we like to talk about and hear about, and how to minimize that and how to be proactive in addressing that. But so those are some of the big things we'll see at this presentation.
Well, and all of those topics, by the way, are probably not on the stage at the other meetings, right? And I think that was probably, my poorly worded question was trying to get at is that certainly emphasizing the point that you have, that probably all of dentistry can learn from what's going on at NOAA, right? And the DSOs specifically for sure. And it's funny that you mentioned the ADA's Health Policy Institute, because I was just on a call with Forsyth and the ADA where they combined. So now that's part of the ADA Forsyth Institute, which I'm super excited about because I'm a big fan of Forsyth and what they do too. And so they're bringing all of this research and together. But that's a whole nother podcast we could talk about for another 10 hours. But so you at D4 actually have this knowledge of both the DSO world and the FQHC world, and you combine that to help basically now. There's many ways that you can help DSOs then. So what are the top opportunities that DSOs have that in your mind to sort of el- improve access to care, improve the revenue, improve compliance, and improve even something as simple as reducing no shows?
So if I take a step back for a minute, some of the other barriers that I tend to see in both worlds is that sometimes these dental practices can be led by people who are smart people who want to do the best thing but don't have a lot of dental experience, and that can hurt. That can hurt the program. When we look at FQHCs and DSOs, it's for us usually it's usually about starting off with the culture and building that culture within the practice that's going to favor the energy and the positivity that you need to provide that care to your patients that's going to lead to success. It also depends heavily on leadership. You need good leadership in both the DSO space and the FQHC space, because if you don't have that leadership, it's chaos. People are doing what they want to do. Things aren't delegated properly. We all as human beings, I feel we're visual learners, right? We learn by what we see. And when we have those leaders in those positions that are gonna show us how to be the right leader and do things the right way at the right time, again, that's going to help build that culture. The other big thing is, we tend to see gaps or voids between the leadership and the frontline workers. And it's almost like you're coming in and in my practice has needed this before, but sometimes you need a third party to come in and show you where the gaps are to get that communication better so that everyone's on the same playing field. So those are, I think, are the big things that stick out to me. And once you get those things in motion, then everything falls into place.
Oh, I couldn't agree more. I love the perspective. I think that doesn't matter how great your leadership team is in your DSO, the core of your business is a patient walking into an office, right? And what's the experience that they have? And And that experience is going to have your numbers go up and to the right or down to the right. And I think that that gets missed in a lot of groups, okay, because if you haven't been in a dental practice, you know those days when things where everything's hitting on all cylinders, and the patients know that they can sense it, and that is a key component that I think is often overlooked. I also agree with you 100%. You know, we've always had consultants that when I was running my practices, even if they're saying the same things as I'm saying, you can't be an expert in your own house, right? So having somebody else come in and say the same thing, people are like, "Oh, that's genius." Then you can be sitting in the back of the corner of the room going, I've been saying that for 2 years, so, I mean, it's very difficult to now it's great because I can be an expert in the practice because 'cause I'm never there. So when I do show up, I'm like, "Hey, I'm the consultant," right? Yeah, so that's a phenomenal perspective. I asked you sort of a specific question, you pulled it back to probably a much more higher priority and I believe there's a massive leadership void, not just in dentistry and kind of the world, but so how would you what advice would you have or how do you build leadership within an organization when I believe that that's very difficult to do because I think there's a lot of I even think there's a lot of misconceptions about what leadership is.
Yeah. So the first step is to define who that leader is and to look for those leadership skills, right? And let's face it, in dentistry, coming out of dental school, we don't have any leadership training. So it's usually, baptism by fire and you got to figure it out by yourself. But, for me personally, when I look for leaders, honestly, I look for people who have been involved in athletics before, who have been teammates, who have had positions before in leadership. Again, for me, I look for passionate people. I feel like skills can always be taught, but if you have that passion, that can't be taught. You're born with that. So if you have a passionate person and you have a person who can possibly be a leader, sometimes it takes time to groom them, to mentor them, to coach them. But then when you get them into a position where they're a leader, everyone else is going to follow suit. It's just the way it is. It's the way we are as humans for the most part, I feel. Does that kind of answer?
Oh, absolutely. Yeah, definitely. Definitely. Well, and I know, like I said, we could talk for 10 hours about how, especially about, I love the perspective that you're working with FQHCs and DSOs and see how, boy, there's this gap here that you can bring knowledge from. It's not even another industry, another aspect of this industry that's been doing it for longer, basically, right? To help DSOs. So if there's people who are in practice or if or they have a DSO and they want to learn more, how can they get more information?
So they can certainly look us up at D4 Practice Solutions. I would also say one thing that, Brian, I think for us, what's a little bit different is, yeah, we have different backgrounds. Our consulting comes from, different dental environments, whether it's FQHCs, private practices, DSOs, even dental schools or large portable dental or mobile dental programs. You know, what I always was intrigued about with one of the big Boston hospitals was that when they provide care to a patient, it's not one person, but it's a team of people. And we're all human, we can make mistakes. But when you have multiple eyes on one person or one program, you have different perspectives, you have different angles, you have different feedback from people. So I've kind of copied that structure within our consulting business. Like when we do consulting, it's not one person or two people doing a consulting job. It's a team. It's three or four people. Because I like to get more eyes on it. I like to get more perspectives because we can all miss things. And so, for us, I think that kind of separates us a little bit along with our history of, the different dental spaces, environments that we've consulted with.
Well, that's great. I that's very unique. I've not heard of like when a team goes in to look at the practice or the organization from different perspectives. Also, just you alone come at it from so many different aspects of the industry. We've only scratched the surface of of sort of the hats that you wear in the industry, which are long and impressive. And I think that's key. You know, if there's a lot of consultants in dentistry who've never even held a handpiece or haven't run a successful practice, let alone a group of successful practices. And they just kind of come at this from the perspective of, well, boy, I've got a hammer and I'm looking for nails to pound in. And you obviously come at it from so many different perspectives, but then even you who come at it from different perspectives are bringing in a team who bring their own perspectives too. So that's great. So I would recommend, if you are in an org, and right now I think we're at a point in time where this is Bryan talking, not Mark. So you can confirm this, or maybe you want to stay out of this because it's a little feather ruffling. I think most DSOs have grown through aggregation, right? By borrowing money and buying EBITDA and scaling that up. Then they've hit a point in time right now where interest rates are high, so that's very difficult to. So like, boy, we have to grow our practices, and that's a totally different business that they've never been in before, right?
Yeah.
And so I think it would behoove them to reach out to D4 Practice Solutions and get some insight into how to actually pull that off.
Thank you.
So that's my perspective on which probably isn't as rainbows and bunnies as yours with providing leadership to the practices. But I think that a lot of DSOs are in trouble, and there's going to be a lot of consolidation, and you're going to be on one side of that, either buying or selling. And probably the ones that are buying, not selling, are the ones who are going to be able to figure out how to put in the leaders and how to grow their practices, leveraging what you talked about.
That's great, Bryan. All salient points I want to add too. I read both of your books. I love them both. I love how you are just right to the point, so direct, no messing around. My mind was opened by several things that you said in there, which, one thing was actually kind of mind blowing to me, but whatever. But thank you for, educating us and everything that you've shared, because it's very valuable. So I thank you for that.
Well, thank you. And thank you for all the work you're doing. And I mean, across multiple aspects of the industry. And so if you want to find out more information and get involved with D4, go to d4practicesolutions.com. Thanks, Mark.
Thank you, Bryan.